So welcome to today's 1-hour webinar hosted by Prevention Plus Wellness, LLC, located here in beautiful St. Augustine, Florida. My name is Dr. Chudley Wirch. I'm the CEO and founder at Prevention Plus Wellness. So today's session is on the SPORT and InShape's Prevention Plus Wellness program, single session evidence-based program, SPORT for youth, high school, middle school, elementary school versions, InShape for young adults, being used in college campuses, communities, U.S. Air Force. And so we're going to look at these unique evidence-based one-session programs and training. And so a lot of content. So after the end of today's session, I'll take any questions you might have or look at your comments. So please do, as we go along, feel free to type into the chat space or the Q&A, and I'll answer and address all those comments and share those comments at the end of today's session. Will last about an hour. So we're recording today's session. I'll send you a link to today's recorded session, so you're welcome to share that with your colleagues around your region or your state or your nation. And I'll send you a PDF of today's slides and a certificate for 1 hour CEU for joining us today. Okay. Thanks again for joining us. And I really appreciate all you do. God bless you guys for making a difference in the lives of children and families in your region, part of the country. So it's an honor to spend time with you today. Today's objectives, we actually have 3 session objectives. One is to explore contents as well as steps for implementing SPORT and InShape. SPORT and InShape are our alcohol drug prevention plus wellness programs. SPORT, as I said, is for, we have versions for high school, middle school, elementary school. InShape is for young adults. So we actually have, therefore, programs that address the whole developmental range of young people, from children, I'd say maybe even 3rd grade, 4th grade, all the way up to young adults, ages, 25, 26 or so. So you get that whole range of age. And of course, as youth age, they become greater at risk for substance use, and they're even at greater risk for chronic disease risk factors, which are all addressed in prevention plus wellness programs. So that's one objective. Second objective is to examine the scripts and the PowerPoint slides used in these 2 programs, SPORT and InShape, Ppw, and the scripts for implementing these to youth and young adults individually, as well as in group settings, in person, as well as online. So I'll show you all that and the flexibility. That's what makes these prevention plus wellness programs some of the more adaptable and feasible practical prevention programs you'll find, and you'll be more likely to use these in your toolbox than perhaps more intensive or multi-session prevention programs. So, and of course, because of their nature of focusing on positive behaviors, the wellness behaviors, promoting physical activity, breakfast, nutrition, sleep, stress control, very, very positive programs, and therefore entertaining and desirable for youth and parents and funding agencies and communities and agencies, etc. Third objective, review built-in evaluation tools and training opportunities for those prevention and health providers interested in using PPW programs. So let's start with SPORT, Prevention Plus Wellness. We got a high school version on the left, middle school in the middle, and elementary school on the right. We're actually making some adjustments to these, little updates to these by the end of the year. There'll still be 2021 versions, but we're going to make some updates with regard to our evaluation tools primarily, and steps for implementation. So you'll find those going on starting now throughout the rest of the year, a little bit of updates on these programs. The SPORT Ppw program is evidence-based. And when I say evidence-based, because there's no single agreed upon definition of what an evidence-based program is. When I say evidence-based, I mean that these programs, SPORT and InShape, have been evaluated rigorously in a number of randomized trials. They found to be effective. That has been published in research papers, refereed research papers, and then these two programs, SPORT and InShape PPW, have been listed on a number of evidence-based registries. So that's the process. For SPORT, our research shows that the single session SPORT lesson can prevent alcohol along with tobacco and cannabis, and significantly increase physical activity among both non-using and substance using youth. SPORT program like InShape targets not just alcohol and other drugs, but also physical activity, healthy breakfast and nutrition, sleep, and stress control. It's a single session. It could be implemented, I would say, 45 minutes, sometimes even a little less, and it can be expanded easily to include an hour and even multi-sessions. It is a screening and brief intervention, which, by the way, is considered an evidence-based practice by SAMHSA, the Substance Abuse Mental Health Services Administration, World Health Organization, NIAAA. A bunch of organizations have identified screening and brief interventions as evidence-based practices. So that's what all PPW programs are as well, evidence-based practices. SPORT and InShape are implemented with slides. You have a script in your program manual to implement your lesson to youth individually, which is very highly tailored, or to a group, which is a more efficient way. SPORT and InShape and all PPW programs are based on the behavior image model, which is a marketing related theory framework, which emphasizes positive image communications. I'll talk more about that today. SPORT includes optional parent materials, actually a letter and 4 weekly flyers. I'll show you those. Manual, as I said, it comes with a physical manual along with a digital download of your PowerPoint slides and all of your reproducible materials. So it's a single purchase, so you don't have to continue to purchase and buy things from us. And lastly, 9, we have included protocols on our slides so that if you absolutely have to implement this online or virtually through Zoom, through Microsoft Teams or whatever platform, you're able to do that during the pandemic or any time that you might want to reach out to youth and implement this virtually as well as in person. So you got it covered, very flexible, very feasible. These programs are designed to reach all youth, so you have a full public health reach and impact. And because of all these things we discussed, including the fact that they're just a single session. The table of contents on your SPORT program includes these 8 sections or chapters: introduction, step-by-step directions for implementation, a screening survey, and a goal plan / contract. At section 4, you've got the individual feedback lesson script. This is where you provide feedback to one youth at a time. Section 5, a group feedback lesson script to provide it to 2 or more youth. Evaluation materials, lots of evaluation materials, so you can evaluate fidelity, process, outcome. Follow-up parent flyers, as I mentioned, I'll show you those. And lastly, even a link to an additional online goal plan if you want to continue the goal setting process with your youth beyond the single session SPORT lesson. Now, so that you can better understand, for those of you that don't know this, Prevention Plus Wellness programs, including the SPORT PPW program, is again a 3-step evidence-based screening and brief intervention process, SBI, screening, brief intervention. So the 3 steps are: step 1, you screen youth for their health habits. That includes, for SPORT, alcohol and InShape alcohol. Our other programs address other drugs. So, for example, our marijuana PPW program, you'll screen for cannabis. Our opioid PPW program, obviously, you'll screen for non-medical opioid use. And our vaping PPW program, you'll screen for e-cigarette use. But that's not all. You also screen for these wellness behaviors: physical activity, breakfast, nutrition, sleep, and even stress control. So that's the first part, screening. Why screening? What does that do? It's designed to increase awareness of youth of their current health habits. That's the whole point. That's step one. Step two, then you provide feedback through the Ppw screening brief intervention process. You provide feedback, step two, on each of these health behaviors. Again, physical activity, breakfast, sleep, and alcohol or cannabis or e-cigarettes or opioids, depending on which Ppw program we've got. But of course, for sport, it's alcohol. For InShape, it's alcohol. So you're providing feedback on each of these behaviors to youth. You're using positive image terms and illustrations designed to cue or trigger unconsciously in the minds of the youth a desired future self of themselves, more fit and active and healthy and successful. Very, very positive, very desirable, very motivational. And then you link how alcohol or whatever substances, depending which Ppw program you have, interferes with or harms those positive behaviors, physical activity, breakfast eating, etc., and interferes and harms their ability to achieve those benefits and achieve those positive future images of themselves. So that feedback is designed to increase motivation for them to change their behaviors, to improve or to increase their wellness behaviors, and to avoid alcohol and drugs. That's step two, screening feedback. Step three is the action piece. That's where you walk you through setting goals, not just to avoid substance use, but to improve protective wellness behavior. So it's a multi-risk behavior goal setting. And that's the initiation, behavioral initiation phase or piece of the intervention. And then to the extent that you continue helping or reminding even youth to set and monitor and achieve goals, that will increase self-regulation skills, which are so desperately needed among youth in general and high-risk youth in particular. So that's a three-step process: screening, feedback, and goal setting. That's important for you to know, and now you'll understand the program materials and training better. The sport Ppw programs, high school, middle school, elementary school, they include these items: step-by-step implementation directions, although we do have an optional 2-hour live online training for program implementers, and we have a 2-hour live online training for training of trainers. And we have on-site training for both implementers and trainers as well. But you've got in your manual step-by-step directions for implementation. You've got the brief self-administered youth health and fitness and behavior screening survey. You've got scripts in your manual to provide your program individually or in a group. A set of colorful slides. The slides are for the visual learner. The slides and to reinforce the image terms and the illustrations, the positive images that you want to communicate to youth while you read your script to your youth individually or in a group. A goal plan contract. Now there's a difference between a plan and a contract, and I'll show you that in a little bit. And that's the initiation, behavioral initiation piece. We have online and paper youth pre-test and post-test surveys to measure immediate outcomes from your program, an instructor survey to measure program processes or quality of implementation. More about all these here in a minute. Fidelity checklist, a letter introducing an optional 4 weekly flyers, and then a set of weekly flyers. This is a completely separate intervention along with your screening, feedback, and goal setting intervention. So it's an additional follow-up or parallel program you can use to get the parents involved, to provide ideas for parents, to provide positive image communications to their youth at home, and to reinforce the messages that you provide to youth with your sport Ppw lesson. So you got 4 weekly flyers, more about that, a phone protocol to track the flyers, whether they're reaching the home or not, by calling a handful of parents or all parents. A youth online follow-up goal plan, as I mentioned. We have online resources as well, which I'll talk about, free resources. We always provide phone and email support whenever you're implementing your Ppw programs. And we also have, as I said, a separate online, we have a separate online training for program implementers, 2 hours, and program training the trainers, 2 hours. How do you implement the SPORT and InShape PPW programs? These are the steps right here. These are right out of the revised manual. The first thing that you want to do is to practice your scripts. If you're going to implement your program to youth individually, practice the individual script. If you're going to implement it to youth in a group, practice the group script. The 2 scripts are not that much different. You could actually toggle back and forth between the 2, implement it to one youth in the morning, to a group of youth in the afternoon, back and forth, very easy, same slides. But you want to practice the scripts. So that's really important. So you're comfortable with the script, almost have it memorized so that you can glance down at the script and look up at your youth and make a good, solid presentation. Number 2, if you have any tailoring of your program slides that you want to do, you want to add some extra content, you want to switch out some of the illustrations, we just request that you send those to us for review and approval before you use anything that you might wish to change. We discuss that more during our 2-hour online program implementer training. Number 3, you want to make copies of your program materials for your participants, the screening surveys, the goal plans, maybe your pre-post surveys, whatever you need, you make copies in advance and bring those to your youth to implement the lesson to them. Number 4, you're going to implement the pretest. We now recommend implementing the pretest. If you choose to use the pretest, it's optional, but we really highly recommend it. We designed the pretest to provide you with the data so that you know how well you're doing implementing your program with your youth. It's invaluable data to promote your program and to improve your program over time. And it's very simple. You implement your pretest 2 times, and I'll talk a little bit more about that. And then you post-test immediately after the lesson, and you'll have all the data you need to see how well things are going for you. Number 5, you're going to implement your program using your selected script. If you're going to implement it to one youth at a time, you use the one-on-one or individual script. If you're going to implement in the group, you use the group script. Number 6, after the script, you read through the goal plan with the youth, and you help them complete the goal plan. Number 7, you're going to administer the post-test immediately after lesson. So really, it's very convenient. You don't have to follow up with youth. You just complete the post-test at the end of your lesson. Number 8, you're going to remind youth to post and to monitor their goals on a daily basis. And also at the end of the 7 days to reset their goals, to set another write another goal plan for the next 7 days. So that's all contained in the goal plan, the goals, and even a calendar log to track their goals. I'll show you all this. Number 9, for the sport program, you can use the sport flyers that you could hand them out, you could mail them out like we used to do it in the olden days, or now you could post them on your website and send parents emails, or you can even email them to parents on a weekly basis. There's a letter introducing the flyers, and then there's 4 weekly flyers, with the idea being some of these hopefully will get through to parents, 1 or 2 or 3, maybe even all 4 of them. And these are designed to give parents ideas as to how to talk to their youth positively about their wellness behaviors and avoid substance use behaviors. So that's a nice follow-up to your single session sport lesson, the parent flyers, that is. Some organizations will meet several weeks if they have access to the kids or to their youth. They'll just meet following week or 2 or 3 and just focus on that self-regulation piece, which is to say, helping them set goals for the next week and the following week and the week after that, and post their goals and monitor their goals, so that they just work on self-regulation, setting goals, monitoring goals, achieving goals, and learning to shape their own behavior change. You could also re-implement your sport PPW program, your InShape program, every 6 to 12 months. So that works as well. And it's really important to think of youth having regular multiple health risks, not just for substance use, but these chronic diseases, being physically inactive, eating poorly, not eating breakfast, not getting adequate sleep, uncontrolled stress. All of these over time will develop into our risk factors for chronic disease like obesity, like diabetes, like stroke and heart disease and osteoporosis, etc. So that's why they need on a regular basis an opportunity, and they get that opportunity through you with your PPW program, whether it be Sport or InShape or whatever program you choose. Give them an opportunity to, number one, reflect on their health behaviors through the screening survey, for you to provide them positive image communications to motivate them, and thirdly, for them to act on that by setting and monitoring goals to improve their health. And that's why we recommend this annual 6 to 12 month annual inoculation, if you will, or vaccine against multiple common risk behaviors that youth are experiencing throughout the country. Step number 10 in this implementation process is for you as the implementer to complete your instructor survey. That assesses, you actually complete a self-assessment of your own quality of program implementation. Number 11, you can complete the Fidelity Checklist at that point every month or so and see to ensure that you're implementing your Sport or InShape or other PPW program with fidelity. If you collected paper pre and post surveys, you could enter your survey data into an online survey template that we could send you for analysis. And then once that's done, you just request from us the data charts and then we'll send those to you from SurveyMonkey. You get charts. We'll send you that. We'll send you the raw data for further analysis. So we're happy to do that, whether your data is collected with the online pre-post surveys or with the paper survey that you hand enter into a survey template. It's all going to be in SurveyMonkey, which provides these really beautiful, colorful charts. Most of them bar charts. You could change it though to another format, and then the raw data as well. And then the only other thing for you to do is number 14, which is to sign up on our website, preventionpluswellness.com. Drop in your email and you'll get notices, usually weekly, of the webinars that we're providing. Right now, we're providing webinars on a Wednesday, weekly basis, webinar Wednesday, and so we'll continue that for a while. Now, let's take a look at the actual scripts and the manual scripts, as well as the PowerPoint slides when you implement your sport program. So we're starting with sport. We're going to start with the high school version first, and we're going to look at the group feedback lesson. And this is the introduction. And you can look to the right of your slide, and you can see there's a very brief introduction. Hello, for the next several minutes, I'll be talking with you about the Sport PPW program. It's an exciting new fitness and health program, and together we'll be looking at what can make you look better, feel better, and improve your performance in physical activities, in school, and even relationships. That's the script. I just read it to you. That's what you would do. You would present this with a lot of enthusiasm and passion to your group of high school students. And that's the script. That's what you read. And you go from your very brief introduction, and you could expand the introduction if you want, but at least now you know what's coming. Now you're going to go right into the screening survey. Remember, screening, feedback, goal setting, those are the 3 steps for implementation. And I read the script. Now I'll take out your copy of the Sport Prevention Plus Wellness Health and Fitness Screen. Of course, you'll have made copies of this in advance, and you'll have distribute them to that one youth or to your group of youth. And the purpose of the survey is to determine what you're doing about your health. Your answers are private, so don't put your name on the survey. We want you to answer, your answers to be secret. We want you to answer honestly. So I'm just going to give you a couple minutes for you to complete that screening survey. Remember, the screening survey now is a part of the intervention. It's the first step. So youth will complete the screening survey. It's theirs. You're not going to collect it. It's just for their awareness. That's the screening survey. What is on the screening survey? What is the screening survey measuring? Here it is right here. Again, this is the high school version of sport. The first question is, what sports physical activities did you play in the last year? There's a long list. It continues on to the next slide. And there's even an opportunity to write in other sports that weren't listed, regional sports. Could be pickleball, like we play here in Florida, lacrosse. It could be, there's just, countless sports. And also you want to give credit for youth for any kind of non-sport physical activity. It could be something fun. It could be work or chores that they do around the house or for somebody else, cleaning the house, cleaning dishes, doing the laundry, mowing the yard, on and on. There's a lot of things. You want to increase awareness of sport and non-sport physical activity. So you've got this covered for those that are sport oriented. For those that are not sport oriented, you want to promote physical activity. So very important. In fact, the goal is 1 hour every day, according to the requirements by the Centers for Disease Control and Prevention. So that's this first question. That's sports physical activities in the last year. Of course, you'll have everybody raising their hands to this or providing something here, because you'll be walking, you'll be biking, you'll be doing something. Second question is a question about regular physical activity to participate in at least 30 minutes 4 or 5 times a day. For example, riding a bike, running, walking, etc. The answer yes or no. Third question is for high school version is do your friends influence you to participate in regular physical activity? That's a social environmental question, very important, because that has an impact on behaviors as well, the actual social and physical environment. That's question 3. Question 4, do you usually eat a healthy breakfast every morning? For example, cereal, whole wheat toast, oatmeal, eggs, yogurt, fruit, etc. Yes or no? And then there's couple other questions. So these are some samples or samples or partial sampling of the questions that are provided on this screening survey to get youth to think about and increase awareness of their health habits. After that happens, after the screening survey, you're going to provide feedback. And you'll provide feedback following your scripts, and the feedback will follow the screening survey format or screening survey items. So the first item, remember, was sports physical activities in the last year. You provide feedback on that first. Then the second item on the screening survey was regular physical activity. You provide feedback on that next, and so far and so on, I should say. So this is your script. It tells you show the slide, which I'll show you next. And then you ask the group members to raise their hands and respond as you read each of the types of physical activities. And this is aimed at promoting the social norm and very positive norm that my peers are physically active. And you're able to do that because you're going back the full year, the full last 12 months, and you're including any kind of physical activity, any kind of body movement, whether it be sport or non-sport or work or whatever the case might be. And so you're going to say who played, who rode a bicycle last year, raise your hands. Who walked last year, raise your hands. Who played basketball last year, not just on a team, but may have just dribbled a basketball, shot a basketball, raise your hands. What other things did you do last year? Were there any chores or activities you did? Raise your hands, and so forth. So lots of hands will be raised, and that's the initial feedback using the group script and the high school version of sport. So there's a restatement of that question, and then you'll have them raise their hands, and then you're going to continue feedback. And the feedback is provided in this 2-step process. The first step, you're going to highlight the benefits of that wellness behavior. And in this case, it's sports physical activities in the last year. It'll say, show your slide, and I'll show you the slide next. And here's your script. Good for you. Sports and physical activities are a great way to get regular exercise. Both sports and other physical activities can be fun. They can help you look fit and strong. Those are very powerful image terms that evoke a future image of themselves. Who doesn't want to be more fit and strong? kids want to be, we want them to be, parents want that for the kids. We want that as ourselves for our adults, fit and strong, feel good about yourself, give you lots of energy, and help you do better in school. So there's that linkage between activity and physical activity and school success. So to highlight the benefits, there's an actual slide that you show. Look at the content. Number 2, fit and strong. Those are those image, feel good, energetic, etc. And then you got the illustration, and we're showing lots of both genders, different ethnicities, different activities, a lot of different things so that youth can see images of themselves or models of themselves in these pictures. And then after you highlight the benefits, you're going to link how alcohol and other drugs interferes with achieving that wellness behavior, which is sports physical activities, and the benefits in the images. And here's the content to the right, actually right out of the script. However, an active lifestyle and alcohol don't mix. Using too much alcohol can hurt your performance in sports and physical activities in school. It can also have a negative impact on your health and your relationships with friends and with family. So that's how we connect and integrate, wellness behaviors with the prevention of harmful substance use behaviors. And there's that a slide, because it says right there, show slide on the bottom on the left, and then there's your slide with your image, with the words and the content, just a review for the visual learner. Sorry about that phone call. So other further topics that are presented that you'll present using your sport program are following what we just showed you with sports physical activities in the last year. You'll present feedback on regular physical activity norms, breakfast and nutrition, getting adequate sleep, and alcohol use primarily. All of this will be in your screening survey, and you'll provide feedback on all of this. When you get to alcohol, some of the alcohol topics, and there'll be a little extra content in that alcohol section or that drug section, whatever it might be. If you use one of our other programs like the marijuana Ppw program, it'll be the marijuana section. But anyway, for the sport, it's alcohol. And these are the topics because more topics, more slides, because you're addressing multiple risk factors associated with substance use. So alcohol can harm your health and fitness. Alcohol can cause life problems. Alcohol myths. Most youth do not use alcohol, which is a very important social norm message. Choose for yourself, plan ahead, and recommendations for increasing your wellness. All of those are addressed under the topic of alcohol and drugs. Eventually, as I said, the last item there, recommendations for increasing wellness will be all of these things. Notice number 5, you're going to recommend to your youth during your lesson to avoid alcohol, but also other substances, because they're all harmful, whether they be tobacco or e-cigarettes or opioids or marijuana. And then these other items, number 1, plenty of sleep. Number 2, healthy breakfast and plenty of healthy foods, especially fruits and vegetables. Number 3, plenty of physical activity every day. And even we've added at the end here, number 4, stress control techniques. So all of that's recommended for your youth to be well, to increase wellness, to have full well-being. Also within your presentation of your sport Ppw or InShape lesson will be discussion questions, or sometimes we call them stop and think questions, because we want youth to stop and think about their own lifestyle. This is how they change their habits. What am I doing? So, for example, what types of healthy foods do you like to eat, or would you like to eat more of? This is the discussion question when you provide feedback about breakfast and nutrition. Very important. And then you also get some discussion going as well, to the extent that you have time during your lesson. Third part of your lesson, remember, screening, feedback. We're done with feedback. Now completing the goal plan / contract. Let's take a look at it. Your goal plan contract has these 6 components: recommendations for wellness, which I just showed you. Youth either are asked to pledge or to select specific alcohol drugs that they'll avoid in the next 7 days. Number 3, to write an achievable, a measurable wellness behavior goal to increase from those 4 areas, one of those 4 areas, whether it be sleep or physical activity or breakfast and nutrition or stress control. They sign and you co-sign. That's the contract piece. They sign and you co-sign, very important. That increases motivation for change. Number 5, you ask them to post this and monitor their goals for the next 7 days, and they're going to check off whether they've achieved a goal each of those 7 days, and then they'll have a total goal achievement. And then lastly, you do want to congratulate them for achieving their goals. You're going to give them some really important instructions as to how to post and track their goals, monitor their goals, and of course you want to give them a little bit of extra feedback and a motivation to go forward in setting future goals and to achieve the goals for the next 7 days. Very, very important. So those are the components of the goal plan contract that Prevention Plus Wellness provides. A little bit about the screening survey and goal plan options. Certainly you get a hard copy, which you can make from your digital download. You've got your manual and then you got your digital download I had mentioned. You can make copies, hard copies of screening survey if you implement it in person. What happens if you can't implement your lesson in person? You have to do it virtually, and you can't get your youth who are participating a screening survey and a goal plan. That's that second block. We have PowerPoint slides with a link on them, and they click on it, and that takes them to a screening survey, and it takes them to a goal plan, and they can complete that online. And then lastly, we do have another online secondary or follow-up online version of the goal plan to encourage, or as an assignment to have youth continue to set a goal plan. The 2nd week, the 3rd week, the 4th week, whatever you can do to have youth continue to set goals, that's a good thing. That's the group script. That's how you implement your Sport Ppw program to youth in a group, 2 or more. How do you do it individually? Well, this is the initial piece of the individual script or the one-on-one script. You can see the directions under, you're going to provide that feedback, sports physical activities last year. There's the directions right below that. You're actually going to take the screening survey from your youth and glance at it and see how they answered it. Or you'll just show the slide, which repeats the screening survey question, and just have them answer aloud. So for example, let's say they answered aloud, or you looked at their screening survey and they checked off that they did get some sports physical activities last year. Then you read the yes, the green, the good, the go response, which is, I see that you participated in biking and walking and even some basketball. Good for you. So there's that initial feedback. You're just recognizing where they're at with regard to that wellness behavior or that risk behavior, in the case might be. And then if they checked off no, they didn't get any sports physical activities last year, or they verbally said no, then you read the no response, which is highlighted in red, which is sort of like warning or stop. And there it is, the bulleted response. I see that you may not be playing any sports or physical activities last year. You can really improve your health and how well you feel by being a little bit more active. So you can see the feedback on the one-on-one script is customized, it's tailored. It's either positive, good for you, congratulations, you're doing the right thing, or it's neutral, no negative, because we don't want to tune anybody out from listening to our messages. It looks like you may not be getting sports physical activities. It's really important to get that. It'll help you do better in school and relationships, etc. So that's the difference between the group and the individual script. The individual script's a little bit more customized. We do know that tailoring can improve efficacy of intervention, so it's likely that the one-on-one script could be more effective than the group script, but the group script is more efficient, obviously, and more practical in a lot of settings. After this initial feedback, then of course the rest of the script is pretty much the same. The slides are the same. So whether you implement it one-on-one or in a group, they get the core information. Let's turn our attention now to evaluation. Evaluation materials, 3 key things that you get in your prevention plus wellness programs, whether they be sport or InShape or marijuana, PPW, et cetera, is a pre-test, post-test survey, which measures outcomes, instructor survey, which measures quality or processes, and a fidelity checklist, which obviously measures fidelity. Let's take a look, first of all, at the pre-test and post-test. The pre-test and post-test it comes in 2 versions, either an online link or we could even send you a QR code. That's one version. The other version is the paper version. Whether either version or both versions measure immediate pre and post program outcomes. So again, critical information for you to determine how well you're doing, to promote your program and to improve your program. Really, really great stuff for you, and information that you may never even have had as a prevention specialist. That's why we created this, because prevention specialists and other health specialists that provide these kinds of programs, you don't see the outcomes that you may, because you're preventing, you're preventing substance use. And so you're going to measure substance use, but you're also going to measure the promotion of wellness behaviors in your pre-post survey. One of the measures, because your measures are immediately before and after your lesson, you don't have a follow-up, so you can't measure behavior. So what you can measure are indicators or predictors of behavior. Behavioral intentions is our best known predictor of future behavior. You got 5 measures of behavioral intentions of substances: alcohol, cigarettes, marijuana, e-cigarettes, and opioids, and 5 healthy habits as well, behavioral intentions of 5 healthy habits: physical activity, nutrition, sleep, stress control, and goal setting. So you're measuring what are the intentions of these youth in the next year to engage in the wellness behaviors and to avoid participating in the substance use. Really, really important measures, behavioral intentions. There's also, in the blue box, perceived harmfulness, 5 substances, save 5 substances as behavioral intentions. Again, alcohol, cigarettes, e-cigarettes, marijuana, and opioids. Nice broad measurement. Perceived harmfulness, as youth perceived a substance as being more harmful, they're less likely to use it. So that's what we're looking for from pre-test to post-test, an increase in perceived harmfulness. Since your sport program addresses this directly, it's very likely to see change in that from pre to post lesson. Social norms is the third added new measure now, again, on all 5 substances. To what extent do they perceive their peers using these substances? And that certainly drives youth. To the extent that they think most or all of their youth are using marijuana, they're going to be more likely to use marijuana. If they don't think their peers are using marijuana, they're not less likely to use marijuana. And this can be changed. This perception can be changed by your Sport InShape and other PPW lessons. And lastly, the post-test has 2 qualitative items to get really important information feedback in the words of the participating youth or young adults. That also very important to help you understand your quantitative data and vice versa. It helps fill the gaps, if you will, and a really important content for promoting and improving your program. The Instructor Survey, which is the process measure, it's a measure of quality. It's a self-assessment tool. Each time you implement your PPW lesson, you complete the Instructor Survey to assess how well you implemented it. For example, did you implement with a lot of enthusiasm and passion? Very, very important. But this tool, Instructor Survey, can also be used by a supervisor or manager as an observational tool to see how well you practice or to see how well you presented the lesson, and then provide you with positive feedback. So there's 7 measures on this, and one of them is enthusiasm and passion, which is very, very important, I think critical. In fact, when you present PPW lessons, because it's a motivational intervention. So you've got to motivate these young people. And so if you're not excited about the program, they're less likely to be excited about it. So that's really, really important. That level of a passion and enthusiasm whenever you present prevention plus wellness lessons. The follow-up parent letters, the follow-up parent flyers. I said there's a parent letter. You could co-brand that. You put your organization's name on it, your name. You could send that out to parents. Again, you could email it. You could hand it out to youth. You could snail mail it. You could post it on your organization's website. But whatever you want to do, you want to get these letters out and make them aware, parents aware of them. And this provides a positive behavior and image communications that you present to your youth. You want the parents to reinforce that. So what does this look like? What do these flyers look like? Here's one example. Again, this is the high school sport version. Essentially, what you've got an introduction to the flyer and a conclusion to the flyer, but this is the core of the flyer. This is the health and fitness facts. And essentially you're giving parents samples of what to say to their youth, very brief, positive communications that parallel and reinforce the messages that you give to youth during your sport lesson. So, and we have it set up in a checklist format. If parents want to be, use the checklist to remind them. If they want to hand the flyer to the youth to read, all those things are good. But this is an attempt to, and it has been found effective. We did one study with 3 of these 4 flyers, and they were effective in preventing alcohol and marijuana use among youth. So very good additional tool in your sport toolbox, and that's the parent letter and 4 weekly flyers. We have a bunch of free resources as well on our website. And these are some of the things. Go to preventionpluswellness.com, look under resources, and you'll find all these things. Resources to promote your program awareness in your region or among your parents or students. Program tailoring and evaluation support and the latest evaluation tools. A logic model to learn more about PPW. Research on SPORT and InShape on their effectiveness. Sample grant proposal, healthy youth guidelines, PPW youth teacher parent web-based resources, and that online goal plan. So lots of free things on our website, preventionpluswellness.com under resources. Now, just to contrast, that was the high school sport program. What does the elementary school version look like? The content is pretty much the same. A little different with the screening survey. Notice the first question is just yes or no, trying to make it easier for these elementary school kids, whether they're 3rd grade, 4th grade, 5th grade. And so that's the key difference on the screening survey, just yes or no items to make it quicker and simpler for them. Do you play sports, physical activities most days a week? For example, riding a bike, walking, running. There's a slide, and you could see the slides, the difference here. You're showing kids versus, older adolescents. So that's a key difference between the middle school, the high school, the elementary school. It's the illustrations. Here you've got the kids, there's the same discussion question. You want to have interaction, but notice these beautiful images of these little children versus older adolescents, for example. And the script is a little bit easier as well. So that's the key difference, a little bit of difference in the content, certainly differences in the illustrations or the images for a high school versus middle school versus elementary school. How about that sport? How about InShape? InShape for young adults, whether young adults are in colleges or communities or military. InShape, like sport, is evidence-based. We found through a number of randomized trials, it was proven to prevent alcohol, cannabis, drinking, driving, including heavy alcohol and heavy cannabis use. That's really important in terms of potential negative outcomes. Increased physical activity, sleep, health-related quality of life among young adults. Like sport, InShape targets alcohol as well as tobacco in this case. Physical activity, healthy eating, sleep, stress. Single session, a little bit longer than sport because it has a little more content. slides, scripts to implement it one-on-one or in a group, same positive image, behavior image theory, a manual. You get digital downloads. You can present it in person or online. Here are the screening survey questions. So you can see the difference. The first screening survey asks about moderate physical activity. The second screening survey asks about vigorous physical activity or exercise. So they're making that distinction and even giving a direct a definition of vigorous exercise as being sweating and breathing hard, and basketball, soccer, running, that kind of thing. A little bit different question. Instead of about breakfast, the question 3 is about nutrient-dense foods. Do you usually eat nutrient-dense foods every day? And there's definitions or examples of that: lean meats, dark green and red vegetables. Number 4, do you get 8 hours of sleep? And number 5, do you use stress control techniques? Are some of the questions on this, on the InShape screening survey. So let's look at the feedback. On most days of the week, do you engage in vigorous exercise for at least 20 minutes? Makes you sweat, such as basketball, swimming, fast dancing, etc. Here's the benefits, and notice right away you can see a little bit more content in the InShape program as compared to the sport program. There's the benefits, and here's how alcohol and tobacco in particular harm those being able to do physical or especially vigorous exercise. Weight gain, loss of energy, bouts of depression and unhappiness, etc. So now you get a little sense of sport, high school, middle school, elementary, InShape for young adults. We offer plenty of training. Online is the most, I think, practical. We got a 2-hour online program implementer training, 1 to 2 hour train the trainer. We can do both the program implementer and train the trainer all in one session on site. If you need us to come out to your site, we can do those separately, and we have weekly webinars. Just go to our website, preventionpluswellness.com, and drop in your email. That's preventionpluswellness.com. Our phone number here in St. Augustine is 904-472-5022. And you can email us at info@preventionpluswellness.com. There's a little shot of our website. So that's it. I'm going to pause at this point and open it up for any Q&A, see if anybody had any questions. So I'm going to open up the chat and go back and make sure I didn't miss anything that was asked. So I'm going to go back to see people were still introducing themselves, so sort of cut that off a little bit. So I'm going to go back all the way back to see that we've got people. We left off at Montana. We got people from awesome people from Detroit and New York City and Brooklyn and Trinidad and Tobago. I'm not sure how to pronounce it, I'm sorry. Beautiful islands, and Maryland, and more from New York, Schenectady. And can we get a copy of the PowerPoint and recording for staff that could not make it? Yes. And everybody who's registered for today will receive a link to this recorded session, and they'll also receive the PowerPoint slides. So no problem, and please do share them widely, and thank you for that. And then we've got to see, Maria says, honored to be here from Panama, which is awesome. And let's see, hello, would it be possible to download most up-to-date versions of sport? Well, if you ask me, if you send me an email, either at info@preventionpluswellness.com, or you go to our website, preventionpluswellness.com, and click on messages and send me a message, I'm happy to send you a sample, a redacted sample of sport. Just request what version you want: the high school, do you want the middle school, do you want elementary, or you want more than one, or you want InShape, whatever you want, or some of our other programs. Just request it and I'll send you a sample of those programs for you to review. So that's a possibility, not a problem. I love the idea of parent flyer. Excellent idea. Thank you. And I think even better than that, what we did more recently is we converted most of our programs like sport, for example, and like InShape, we converted them into parent training programs. So not only do we have the sport program for youth that you would present, or you would train others as a trainer to present, but we also have the sport parent training program. So it's a program where you'd offer a one-session training of parents and caregivers in your region to provide the same positive image communication and goal setting at home, which would reinforce what you're doing when you present your lesson to your youth. So check it out on our website. We have the parent PPW programs. So we've really gone from just the flyers to having a separate parent program, and you can do that in one session, very efficient. You get the training slides, you get a handout for the parents to take home. It's all very, very easy to implement. And we could provide training for you to walk you through those slides as well. Let's see here. We got some of our prevention programs are housed in our health center. Do we need to have schools do this program, or should we be an outside program to do the evidence-based curriculum? If I can get more information for a coalition, that would be great. So sports being implemented in all 50 states and abroad, and it's being implemented within and outside of school, just about any setting where you could think of where there's youth. So in school, within existing classes, whether it be PE or health or science or whatever, lunch break, after school, within school sports, community sports, community recreation, community clubs, boys and girls clubs, court diversion programs, YMCAs, physical exams for youth. Again, everywhere where there's youth, you can implement the single session program, very, very flexible. So it doesn't have to be in a school setting. And in fact, the more settings it's in, the more likely youth will get this, these messages reinforced from different sources, whether it be a teacher or a coach or a doctor or nurse or a parent. All of that is good, and the more good, the better. So I hopefully have answered that. Emery, let me know if I answered that for you. Thank you for the timely session. My pleasure. Very informative. You're welcome. Craig from Colorado, beautiful Colorado. Thank you for your presentation. My pleasure. Most schools aren't allowing anyone presenting in person. Could you please send me QRs for virtual? So you'll have to request that, Michelle, from me. Send me an email. And of course, you'll have to have a manual to implement the program. So let me know which program you're implementing. And what we can do is, and really you need to have the training with that as well, Michelle, the 2-hour online training, so we can walk you through that. But we could send you either links to the pre and post test, or we could send you a QR code, and that will be customized to your organization. So if your coalition is ABC Prevention, what we'll do is we'll send you a link or a QR code to ABC Prevention Pretest, ABC Prevention Post-Test. So that's how we do it. So let me know if you have any questions about that, Michelle, or give me a call today, 904-472-5022, or shoot me an email at info@preventionpluswellness.com. Hi, Chudley from Carmina. Hey, Carmina, good to hear from you. Michelle is saying, good question, no visitors in schools. So it's always a challenge. Let me just say a little bit more about this. It's always a challenge to get into schools, but you've got several things going for you with the PPW programs. Number one, they're just a session, okay? Number two, you can implement them in just about any setting in any way. Number three, they're very positive and they focus on things outside of or in addition to substance use. So historically, you'll find schools, for example, and other organizations that might say, we don't have that problem here. We don't have that issue. Well, on our website, under the heading of resources, under the heading of promoting your program, there's something called the Ppw Menu. And that is a 2-page questionnaire that you could take to your school administrator or any decision maker and walk them through it and say, do you want to address obesity in your school? Do you want to address nutrition, breakfast, sleep, physical activity, stress control? Oh, and yes, alcohol or marijuana or opioids or vaping. And then it goes on. We could implement this to youth individual, take them out of school. We could implement it within a sport program. We could implement it after school, whatever. And it's a menu. You give your decision maker, whether that be a principal or whatever the case may be, options, and that will help you open the door to get your single session PPW program lesson provided. That's why we created that. Now that's called the Ppw menu, program menu. It's under resources, under our website, preventionpluswellness.com. Check it out. Let me know if there's anything else we can do to help you get access to present your PPW lesson in your setting, whether it be school. And if you can't, ultimately, let's say you can't get into schools, then reach youth through other venues, through other community organizations, through the churches, through whatever the case may be, through the hospitals, behavioral, whatever it is. You can get this lesson out there. The whole idea is that this brief lesson is designed to reach all youth. Schools, obviously the best scenario because you got everybody there, or most of them, but you can implement this in other settings. Thanks. We have a wellness center. I think will be perfect for the facility. Okay, that's it. Thank you guys. Great questions, great comments. Great to meet everybody. Thanks for joining us. Again, God bless you guys for what you do. Keep up the good work. Stay safe. Be careful. Get your booster shots. And I hope we can help you out in any way. Let us know at preventionpluswellness.com. Have a great afternoon, everyone. Thank you for joining us. Bye-bye.